All right, so up in Wickenburg, Arizona today, working on a few team roping horses. He feels pretty comfortable up here, a little tightness on the lower left side of his back. Good boy. Let's see here, good boy. So I'm going to check his paraspinal muscles here and make sure that he's not sore. I want them to be nice and supple, not dropping with this pressure. And then I drag all the way back over the SI joints to see if there's any sensitivity there. It feels really comfortable. He's a little high on this right side with his feet pretty much square, so I know I've got a little restriction at the right side SI joint and extension. So I'm going to check side to side and just compare how tight he is on one side with how tight he is on the other. Yeah, so super easy and extension on the left and pretty tight on the right. So I'm going to adjust this side, and I'm adjusting it in rotation down and back in this direction like this, so that it helps him extend on the right. So I'm going to drop him. Ooh, he's a little uncomfortable there. I know, easy buddy. So I'm going to drop him down a little bit. Hey, All right, so we got some pain back there. So I'm going to check this. Oh, okay, all right, I hear you. So you can see a little bit of discomfort there on that right side. So I'm going to adjust. I'm going to check that his left side actually, in flexion. Because if that's the side that's actually stuck, I'd rather adjust the side that's not sore. So let's see how he responds to this pressure. Oh. He's trying to get out of dodge on that, so let's see. He's not pinning his ears on that or anything, just moving away from it. So let's see if he's more comfortable. Yeah, so he's more tolerant on this side. Oh, there we go. Nice release on that SI. Good boy. So I'm going to give him that for a second. There we go. Big deep breath, licking and chewing. Love to see that. That's a good boy. So we have a restriction on the right side in his pelvis, but because of the way the pelvis moves opposite from side to side. So if he's flexing on the left, he's extending on the right. So if he's stuck in flexion on the left, then he'll be stuck in extension on the right, which he is. So a lot of times you can adjust the non-sore side into the direction that it's stuck in, and it'll clear up the other side. I don't know if that makes any sense. But if my pelvis moves like this, forward and back, and this side, like in his case it was stuck down and back like this, I can either adjust this side this way, or I can adjust the opposite side this way, and it'll clear out both sides. Usually I'll adjust both sides in the opposite directions, so in the directions that they're stuck, but opposite of side to side. But if he's sore on one of the sides, then I won't adjust that, obviously, because I don't want to piss that off even more and irritate the already inflamed sides. And you can see he's not happy there, so I'm going to leave that side alone. And because I have that soreness on the right side SI joint, I'm going to be expecting to have an issue at the left shoulder or something on the left front, maybe left lower cervicals, lower neck area, something like that. Boy. Let's see. And he's not sore at the SI joint itself. He might just be uncomfortable at the point of his hips, or a point of this hip on that side. So I'll check that when I adjust the hips as well. Let's see, I'm gonna lift his back up here. That's a good boy. Hopefully you guys can hear me okay. I'm having some problems with the mic. So if you can't hear me, or if you can hear me, you can let me know in the comments. That would be awesome. Move him over a little bit. Good boy. There we go. So he's a pretty quiet guy, so when he shows me discomfort like that, I know that, you know, it's pretty obvious, and he's very communicative with it, so it's not real hard to tell if he's hurting. Some horses it's pretty hard to tell either because they're always really like super sensitive, so everything seems like it hurts. You know, some horses don't like to be touched, so they're standing there pissy all the time no matter what. And other horses, like some of your roping mares or ranch mares, they're just so tough that they don't show much pain at all. Oh, good boy. Good boy. All right, so I'm gonna flex him around. I'm gonna see if he can come touch my hand at his shoulder. Oh, perfect. And a nice release there too. Good boy. Good boy. All right, and then I always check both sides to compare motion. So you'll see if he can come around to his right shoulder. Oh, another big release. That's very easy for him. It's a good boy. And then I'll check some flexion and extension here. So I'm gonna bring his head up. So nose to the sky. Good boy. It's very comfortable there. And I'm gonna bring him down to his chest. See if he's comfortable this way too. Good boy. Oh, good boy. All right, let's see if he'll come down here. Yep, it's very easy. So neck and pull feel good. And because he had those releases and rotation, I'm gonna ask him to do that again. So I'm gonna have him come touch. Perfect. And then I'm gonna have him come back. Boom. Good boy. That's perfect. All right, I'm gonna back him up. Back. Good boy. And I'm gonna give him a really nice stretch in his pole, just because it feels good, and they usually like this one a lot. So I'm gonna give him a little bit of a stretch here. I might find something that needs to be adjusted while I do this. So just another really nice way to check the pole. And again, the pole is the upper neck. So it's where the base of the skull meets the cervical spine. Whoa. So it's where the base of the skull meets the atlas, which is the first vertebrae in the neck. Oh, good boy. That's really nice. Good boy. Good boy. Nothing to adjust there. Super comfortable. There we go. And I like to give him a minute after I do those things, just so he can relax, integrate that stuff. There we go. Good boy. More like a pressure and release. So if he does good with that, just release that pressure and let him have his head for a minute before I go on to the next thing. Let's see. All right, so I'm gonna check his legs. I'm gonna check his right side first, because with that soreness in the right hind, I'm expecting some soreness in the left front. So we'll do the good side first. And see, I feel a little release in that knee right there. Good boy. That's a good boy. All right, I'm gonna bring his leg out and see if he'll fully extend on that shoulder for me. That's a good boy. Sometimes they'll turn their heads to the opposite side and lean away a little bit, and I think that's because it really helps open up their chest, gives them a really good stretch in the pec muscles. Yeah, there he goes. That's super, super common. So if I'm working on a horse and I have somebody handling the horse, I'll tell them to hold the lead rope loosely and let the horse move around if he wants to do that while I do this, because I think it's really beneficial for them when they help with the stretch. Boy. All right, good. Nice release in that fetlock too. Now I'm gonna check the side. And I'm hoping I don't find anything here, but oftentimes you're on that diagonal, right? So if I have an issue on that right hind, often there's an issue on the front left as well. So, and the reason for that is when they have an issue on the right hind, they'll compensate for that by putting extra weight on the left front to get the weight off of that area back there. And if they have an issue in the left hind, they'll compensate on the right front. And it's the same thing. If they have an issue on the left shoulder or left front, they'll compensate on the right hind. And right front, they'll compensate on the left hind. Oh, big release in the shoulder. Oh boy. Oof. Oh, and there goes the shoulder. Big pop right there, just bringing the leg out. That's a good boy. Love it when I find, oh, there's another little release there when he just pulled it back. So I love it when things match like that, because then I know I'm on the right track. Good boy. And you can see a little less hesitant to fully extend on this side, the way he's yanking that leg back like that. Yep. Oh. So we might just have a sore shoulder that's causing that sore right hind, sore SI. Good boy. Oh, there we go. And a big release on that left front fetlock as well. There we go. Their legs are usually their favorite part, so you'll see them licking and chewing and yawning and taking these deep breaths pretty frequently when I'm working on the legs, especially the front legs. So if I have a horse that's not comfortable or just not wanting to relax right off the bat, and I usually like to start on the hind end, but if they're not comfortable right off the bat, I'll start with the front legs, get them to relax by working on the front legs or stretching the front legs, and then I'll work my way towards the back. Just whatever that horse needs. Good boy. I'm gonna flip him around and work on his back legs. Good boy. Oh. Good boy. There we go. So I'm gonna check this left hind first because it's the good side, right? Right hind had the other issue, so I'm gonna check the left hind first. There we go. Nice and flexible back here. Ooh. And a big hip release on that one. That's perfect. I'm gonna step him over so we can do the other side. Boy, oh, oh. Good boy. All right. So let's get this right hind and see how this feels on him. Oh, good boy. So definitely I think it's more of a left shoulder. Oh, good, and another big hip release on that side. So I think it's more of a left shoulder issue causing the right hind, but just a bunch of releases on that diagonal. Good boy. Now I'm gonna stretch his jaw out, make him really use that tongue, and we'll be all set. If you guys don't mind hitting that like button and if you want to subscribe, that would be awesome. I appreciate you watching my live. And I'm gonna have a couple of these today, so if you stick around, I'll have one or two more horses to do. I also have a lot more short form content in my shorts and on TikTok. And it's Sport Horse Chiropractic obviously for the YouTube account and for the TikTok account. And this is just a really good stretch for the TMJs, for the muscles that attach to the hyoid bone. There we go. Good stretch for the pull because they'll extend like this, and usually they'll rotate left and right. There we go. Good boy. Get a good check of the teeth like this too, which his look really good. All right, we are all set. And thank you guys again for watching, and see you on the next live.